Next, we are going to discuss one of the most important topic in dermatology, which is acne vulgaris. So, acne vulgaris is inflammatory skin condition happening because of obstruction in pilosebaceous gland. So, sebaceous glands, they are present throughout the body except for palms and soles. Sebaceous glands, they are most abundant on face, upper chest, arms and back. So you can understand these are the areas, these are sebaceous gland rich areas where you can find the acne lesions. So what is the pathogenesis of acne? Increase in androgens, increase in interleukin 1, increase in insulin-like growth factor 1, decrease in linoleic acid. It stimulates the keratinocytes of the duct of sebaceous glands, resulting in hyperproliferation of keratinocytes of duct of sebaceous gland. So, if this is the sebaceous glands and these are the keratinocytes, so now there is hyperproliferation, ultimately leading to the obstruction of the gland. So, what happens once there is obstruction? There is increase in sebum over here, increase in sebum collection. Over this increased sebum, the bacterial proliferation starts. So, normal skin flora over face is Propionibacterium acnes. So, whenever there is obstruction of the duct of sebaceous glands, there is increase in sebum collection, thereby the Propionibacterium acnes, it starts proliferating. Propionibacterium acnes, also known as Cutibacterium. So, its proliferation starts. Ultimately, it will rupture into the dermis, releasing the keratin, sebum, bacteria, free fatty acids and triglycerides. Keratin, sebum, bacteria, free fatty acids and triglycerides into the dermis and causing inflammation. This inflammation is responsible for the formation of papule, nodule, pustules, cyst and scar. So, this stage, hyperproliferation of the keratinocytes of the duct of sebaceous gland and increase in sebum collection results in comedone formation. And comedones are the hallmark of acne. whereas the inflammation in the dermis results in the formation of papule, pustules, nodules, cysts and scars, pleomorphic lesions. As we already studied in the previous slide that the maximum concentration of the sebaceous gland is in face, in chest, back and arms. So you can find these lesions over these areas. So remember the four main causes responsible for the pathogenesis of acne. Hyperproliferation of the keratinocytes of the duct of sebaceous glands, increase in sebum collection, bacterial proliferation, Propionibacterium acnes and inflammation.